Why do osteoporosis patients need bisphosphonate drug holidays? Osteoporosis patients may need planned breaks from bisphosphonate therapy, known as drug holidays. This approach helps balance the benefits of preventing fractures with the risks of long-term use of these medications. Bisphosphonates are effective in reducing fracture risk by slowing down bone loss. They also accumulate in the bone, which means they continue to offer protective effects even after stopping the medication. This lingering presence allows for a drug holiday without an immediate loss of benefit. One primary reason for considering a drug holiday is to reduce rare but serious side effects. Long-term use of bisphosphonates has been linked to conditions such as atypical femoral fractures and osteonecrosis of the jaw. Atypical femoral fractures are rare thigh bone fractures that can lead to ongoing pain and complications. Osteonecrosis of the jaw occurs when a section of the jawbone does not heal properly, often following dental work. The risks of these conditions tend to increase with prolonged use of bisphosphonates, especially after 5 years. Another important factor is the risk-benefit balance based on a patient's individual risk profile. For those at lower risk of fractures, the balance may shift over time, making a drug holiday a sensible option after 3 to 5 years of treatment. Conversely, high-risk patients may need to continue bisphosphonates longer due to their increased fracture risk and the strong protective effect of the medication. Decisions about drug holidays should be personalized, taking into account factors like fracture risk, bone density, and overall health. During a drug holiday, patients can still maintain fracture protection. Bisphosphonates bind strongly to bone and are released slowly, so their benefits can persist for months or even years after stopping the therapy. This allows patients to safely pause treatment without an immediate increase in fracture risk. However, the optimal duration of a drug holiday and the timing for restarting therapy are still areas of ongoing research. Monitoring is also crucial during a drug holiday. Patients typically undergo periodic bone density tests and clinical assessments to check for any signs of bone loss or increased fracture risk. If any risks arise, bisphosphonate therapy or alternative osteoporosis treatments can be resumed. In summary, bisphosphonate drug holidays are a strategy to minimize rare but serious long-term side effects while still maintaining fracture protection. The decision to start a drug holiday and how long it lasts should be tailored to each individual's fracture risk, treatment duration, and ongoing monitoring by healthcare professionals. This approach aims to optimize the safety and effectiveness of managing osteoporosis. Always consult with a healthcare professional for personalized advice.